in your very busy schedule. And I'm going to pass over to you. Thank you.
So thank you, Sheena, and thanks to the GCVS for inviting me to speak to you this morning. Let me just share my screen. Okay, Sheena, can I just check that you can see that okay?
Yes, thank you. Yep.
Okay, perfect. Okay, well, thank you again for the invitation to come and speak to you this morning. I'm going to speak for about 20 or 25 minutes. I always welcome heckling as well. I can't see anybody at the moment, so you'll need to shout out if there's any heckles you want to. So I'm going to talk a bit about the biggest public health scandal that you might not be aware of, and that's the stalled improvements in life expectancy that we've seen well before the COVID pandemic came about and well before the cost of living crisis came to bear. Obviously, both of those are exacerbating that at the moment, but I think we need to go back about 10 or 12 years to understand the challenges that Scotland faces in terms of its public health. So what do I mean by that? Oh, I've got the screen of death. What is going on here? Oh no. Okay, I can only see a white screen.
Yep, that's what I can see at the moment, Jerry.
Right, I don't know what's happened. That's bizarre. So I'm just going to stop sharing briefly until I try and work out what's going on.
We've got everyone putting who they are in the chat, so thank you everyone. Just take your time, Jerry, to get your slides going. The joys of technology and Zoom.
This is great, Jerry. It makes it less pressure for me.
We all feel reassured at this point. It's just so lovely to have such a wealth of people and experience and expertise. I'm looking in the chat, so really welcome everyone. It's great to have you here, and we will get started shortly.
Okay, let's try again. Can you see that
now,
Sheena?
That's it, yep.
Okay, and you've seen that one. And there we go. Way,
here we go. We're off.
It has moved on. So I'm going to show you a few graphs like this just to set the scene. So this is the amount of life expectancy gain that we saw in England every year measured in weeks. So for example, at the left of this graph, for men in England, they were gaining about 12 weeks of life expectancy every year in the early 1980s, and that was fairly consistent through the 1980s, the 1990s, all the way up to around 2011. So you were seeing a big chunk of additional life expectancy for English men. But after 2010, that just drops off a cliff to almost zero for English men and also for English women. So this is the stalling in life expectancy that I'm talking about. And we see that in England, but we also see that in Scotland. So again, quite rapid improvements in life expectancy on average for Scotland, right up to about 2010, before that just drops off a cliff and actually got worse for some years in Scotland for men. And we also see a similar thing for women, where again, the improvement rate in life expectancy just drops off a cliff in the last 10 years. We see this in Northern Ireland, although the graphs are much bumpier in Northern Ireland because the populations are smaller. But again, same thing for men and women. And in Wales, quite dramatic falls for both men and women. So what does that all mean? So this might be a more familiar way of looking at things. So this is what we would have expected UK life expectancy to do for females and males had the trends between 1990 and 2011 continued. So we would have expected a steady but slow improvement in life expectancy for females on the left and males on the right. But the red line here shows what actually happened. So essentially, life expectancy was unchanged, and you can see the gap growing between what actually happened and what should have happened had previous trends continued, growing over time. And that gap in life expectancy can be counted in different ways. So you can count that in years of life lost. So how much life expectancy, how much time on this planet has been lost as a result of that. And that gap is far, far bigger than the additional mortality that we saw during the COVID pandemic. Indeed, it's an order of magnitude more, because it's not a single year of life expectancy loss, it's compounded over about 10 years now. And so whatever has been causing this stalling in life expectancy is a much, much bigger problem for the population's health in the UK than COVID has been. So I think that's why this is the biggest public health challenge that we face at the moment. But the overall average figures hide something really important. So this is mortality now, so low on this graph is good. So the average trend you can see stops improving around about 2010. That's the hard black line in the middle. But what that hides is that the gap between the most and deprived areas in Scotland has widened over that time, such that life expectancy and mortality rates have got worse in absolute terms in our most deprived areas. Indeed, in the bottom 30% of areas in Scotland, life expectancy has worsened over the last 10 years, and that's an absolute tragedy. Whereas in the least deprived areas, in our more affluent areas, although things are improving more slowly, they still continue to improve. So all of that means that life expectancy inequalities are widening. That's true in Scotland, it's true in England, it's true in Northern Ireland, and it's also true in Wales, although I haven't shown you the data. Now, I can go on about this for days and days, but I'm just going to summarise a lot of the other data in 2 bullet points here. And that's to say that the stall trends have been seen for men and women across almost all age groups. So we've looked at this separately for every age group, and it happens for almost every specific cause of death. So it's not just cancer that's driving this, it's not just drug-related deaths, it's not just any specific cause of death, it's almost all causes of death that are driving this. Furthermore, and again, I could show you graphs on this, but we don't really have time today, that the stall trends are not unique to the UK, and it has been seen across many other high-income countries, in particular the USA, which have got particularly dreadful trends, but also places like the Netherlands and some other European continental countries like Germany. So we've summarised what's going on and the causes of this in a report that we released in May this year that was published by the Glasgow Centre for Population Health. And so I'm going to talk you through a lot of the evidence that we pulled together in this report. And as was mentioned earlier, we also generated a series of recommendations that flowed from that. So we looked at a number of different hypotheses, a number of different theories about what is causing these trends. So that includes that cardiovascular disease mortality is a particularly important problem, that drug-related deaths were a particular problem, dementia and Alzheimer's was a particular problem, flu was a particular problem. So these are all things that Public Health England especially have emphasised as being important, and so we looked at these quite critically to see whether that was the case. Obesity has come up as a possible cause, demographic factors, so the ageing population and the like, austerity has come up as a potential cause, and then sort of climate change, weather, temperature extremes as another one. So we looked at all of these theories and we evaluated the evidence for each of them in turn. So I'm going to rattle through some of these quite quickly. So as I've already mentioned, yes, cardiovascular disease mortality has been one of the causes, but it's certainly not unique. And indeed, cardiovascular mortality has continued to improve, but at a slower rate since 2012. It does make a large contribution to the overall stalling because it's such a common cause of death, but the actual change in the rate of improvement predated the stalled overall trends. And because we see such large inequalities in cardiovascular mortality, the hypothesis that's related to this is that we've kind of run out of new treatments, new medicines that are effective in cardiovascular disease. But of course, we don't see that corresponding improvement across all socioeconomic groups. And so actually there's a lot more gain to be had from the existing treatments and medications that we have available. So we didn't think that cardiovascular disease was at all important as a specific cause of death in driving these stalled trends. And so we're able to discount anything specific to cardiovascular disease as being behind it. It does link, however, to other hypotheses, including obesity and austerity, and I'll talk about them shortly. So as our conclusion, cardiovascular disease, we can kind of scrub it off as something that's genuinely behind these stalled trends. Drug-related deaths, I think everybody in this room is probably familiar with the challenge here. So drug-related deaths have gone up exponentially. This graph's slightly out of date. There's more data now for a couple of years after this. The graphs have continued to show this kind of dramatic rise and then sort of almost plateauing at this new high level. And it's driving a lot of inequalities in mortality, particularly in younger adults. So it's a big problem, and that does drive some of the stalled mortality. The timing of it is consistent with the stalled trends, and so is a contributor. We also know that there's a cohort effect, so that means that the average age of death for somebody from a drug-related death has gone up every year, and that's because we've got a group of people who were exposed to a particularly toxic set of policies in the 1980s and 1990s, where there was mass unemployment, there was a lot more availability of hard drugs, a lot of despondency, particularly in our most deprived communities, and that led to a cohort of people using drugs over a long period of time. And that cohort is now at an age where they are generating a lot of comorbidities, have a lot of issues going on, and it's not surprising in a sense that the mortality rate for that group is now quite high. And that doesn't mean there's nothing that can be done about it. There's a huge amount of things that can be done in terms of treatment and services and prevention, but drug-related deaths alone only contributes quite a small proportion of the overall stalling. So we don't think that the specific causes of drug-related deaths are behind overall stall trends, but it is a contributing factor, and that has been written about at length in other areas, and so we didn't think we needed to add much to what's already known around that. The next area was around dementia and Alzheimer's disease, and this became a particular area of focus again for Public Health England, partly because of the rise in mortality amongst older adults in England, but also in Scotland and the rest of the UK. And we did see that there was an increase in dementia certified deaths, so dementia appearing on death certificates. But there was a big problem with this because general practice was incentivised in 2011 and 2014 to diagnose more dementia in the community, and that meant that when people had those diagnoses on their medical records, it was more likely to be included subsequently in the mortality records. And so we actually think that a lot of the increase in dementia-related deaths is what we would call an artefact. So it's just a change in recording practices rather than a real increase in dementia. And indeed, when you look at age-specific incidence of dementia, it's not increasing, it might actually be falling. And so we don't think there's anything specific going on with dementia or Alzheimer's that's driving the overall stall trends. It's also worth mentioning here that we see the stalling across all age groups. And so again, dementia is quite a specific thing for older age groups. And so again, it's not something specific to, in relation to dementia that's driving this overall trend. Flu became a big focus again for Public Health England, and partly because the stall trends were first noticed in 2015, and that was the same year when there had been a large flu outbreak. We have got a problem with how we measure it because it's not well recorded on death certificates, and it might also contribute to other causes of death. However, we do know that flu tends to affect specific age groups and specific causes of death, and it tends to be more confined to winter mortality. And what we see is that deaths at all ages and for all causes and for non-winter mortality have all changed, which makes flu a much less likely cause. But there's also a much more in-depth analysis of hospital admissions and subsequent mortality in England, which show no change in the contribution of influenza over time. And so we can be much more confident that flu is not a contributor to the changed trends of the stall trends and mortality across the UK as a result. Obesity I mentioned earlier on. So obesity has become a focus for public health attention over the last 20 or 30 years, and rightly so. So this shows some graphs about the prevalence of obesity in England at the top and Scotland at the bottom for both men and women over time. And you can see that between 1995 and 2010, the prevalence of obesity, so that's the percentage of people within the population who are classified as obese, has increased quite a lot. So if you look at the top there, women in England, the percentage who are classified as obese went up from 18% to 26% over that time period. If you look at the bottom, for Scottish men, the prevalence went up from 16% to about 27% for men in Scotland over that time period. So that's quite a large rise, and so you might expect that to have a subsequent impact on mortality. Now, of course, the prevalence has then been stable from 2010 onwards in broad terms, but there is a lag time between a rise in obesity and then subsequent mortality, diabetes, complications, all of that. So it is plausible that obesity has been driving some of these trends. So we did do some more in-depth analysis of this, not least because obesity is linked to a wide range of cause-specific mortality. So it's not specific to cardiovascular disease, it's not specific to respiratory disease, it can contribute across the board. And we do think it's plausible. So we modelled the contribution using PAF measures, so that's population attributable fraction measures, so an epidemiological technique. And what it found was that between 10 or 14% for men and women in Scotland of the stalled mortality could be explained by the rise in obesity earlier on. And the percentage was actually a wee bit higher for England. Now, the percentages can be slightly misleading because the contribution can go above 100% with these kinds of calculations, so it shouldn't be overinterpreted, but it does mean that we think that obesity is probably making a real contribution to the stalled trends that we see today. But there are lots of caveats and uncertainties in that, but nevertheless, we think obesity could be important. Demographic factors, I'm going to skip through this quite quickly. So this came about largely because of a report commissioned by the Health Foundation, which looked at this in detail and led by Mike Murphy. There was a long list of potential demographic factors that he looked at, and at the time he didn't have much data to evaluate them all. We've now been able to look at a longer time series of data, and we can be much more certain that none of these are contributing substantially to the stalled trends. So for example, an ageing population can't contribute to life expectancy changes because it takes into account the changes in the age structure of the population over time. Another hypothesis was around sort of climate change, weather and temperature extremes. So obviously we've seen massive impacts around the world, most recently in Pakistan, of the impacts of climate change, and we are very, very worried about the impacts of this in the future. In a Scottish context, sometimes it's excess winter mortality that's the biggest worry, and that will be obviously an even bigger worry in the winter to come with the high cost of fuel and heating. But nevertheless, looking back to see whether this has been a contributor to the stalled trends over the last 10 years. That doesn't seem to be the case, that there's no evidence that exposure to cold weather increased or the impact was worse. There is some evidence of increased impact of heat waves, but the effect is very, very small in the UK and also small across continental Europe. So it's at the moment unlikely to be making a substantive contribution, but that's not to say that we should take our eye off the ball about climate change. That's going to become a more and more important cause in the future. So the last one, and the one that I'm going to go into much more depth in, is austerity. And for anybody that's seen the report or seen me present on this before, you'll know that austerity is an important cause of these trends. And I want to present the evidence of this because this is not my opinion. This is very much what the evidence says, and it's evidence that's been pulled together from across research groups across Scotland, England, and internationally. And there's three interrelated groups of evidence here. So there's evidence about austerity at international level. So whether austerity has been implemented to a greater or lesser extent across countries and what that's meant for mortality trends. There's evidence specifically within the UK around local government funding, the funding of services, and then there's evidence around at household level, so changes in household incomes and social security benefits, and the changes in that and the implications for health. So I'll take these in turn. So at international level, we already had a very substantial body of evidence on the impacts of austerity when various reports were written in 2018 and 19, but unfortunately these were ignored, and so the narrative has continued that austerity wasn't a big problem. But these papers pre-existed that, so there's a really good paper by Veronica Toffoluti and Mark Sucra, which looks at whether the impact of austerity at international level is important, and concluded very much that it was. There's a paper by Lewis Rajmal and colleagues from Spain, which again show an impact of us through the earlier part of this decade, or the last decade. It wasn't a clear relationship altogether, but there was a substantial contribution of austerity to the mortality trends. And then there's also a paper by Antoninakis and et al. That looked at suicide mortality specifically, and again showed that austerity was harmful. Because a lot of these papers used data from an earlier time period, and we did some more advanced analysis ourselves. So we've done a systematic review synthesizing the evidence, and again this shows a very consistent relationship, although the effect sizes are unclear. We also did what's called a panel regression analysis that used 4 different measures of austerity. So 2 with acronyms, CAPB and AAFI, which you don't need to know the detail of, but these are measures that economists use to look at the balance of government spending versus government tax revenues after adjustment for various other factors. But also we looked at government expenditure on its own and also public social spending, so that's spending on sort of public services. So using 4 different measures of austerity, and we saw that there was a consistent negative relationship with mortality, although it was less clear for one of the 4 measures. So we're very clear now that at international level, countries that pursued austerity policies had worse mortality trends than those that did not, and that's really strong evidence that austerity is at least a contributing factor to the stalled trends. But that's not all. So we have really good evidence at subnational level as well. So there was some initial work by Stephen Watkins and colleagues that associated cuts in social care with excess mortality. Now that did get quite a lot of coverage at the time and was raised in Parliament, but it was kind of poo-pooed by some of the politicians. But we had subsequent work that was much more robust in terms of their methods, which demonstrated even stronger relationships between reduced local authority spending and budgets and excess mortality. So the paper here by Alexio and colleagues shows that really clearly in England. And then we've also got a whole package of evidence at household level as well. So, oops, I've pressed the wrong button. So household level. Now, there are difficulties with the data here. So the DWP still do not facilitate linkage of their data that would allow us to link individual benefits and benefit sanctions to health outcomes. But we do have something called the Understanding Society study, which allows us to do this for a smaller sample of the population of the UK. And what this has showed is that we have negative impacts of universal credit on psychological distress. Understanding Society is not big enough to link to mortality records, so we can only rely on mental health outcomes for a lot of these studies. We also know that changes to the lone parent eligibility for benefits was associated and causally associated with worse mental health, a paper done by colleagues in Glasgow. And then we've also got papers that show that increasing poverty at local authority level was associated with worse infant mortality trends in England. And we also did some modelling ourselves, looking at changes in tax and benefits, and showed substantial negative impacts modelled for the changes that we've seen over the last decade or so. So taking all of this together, we find consistent evidence at these three levels that austerity has been an important contributing factor to the stalled trends, and that even countries that introduced austerity at various points, including Germany and the USA, which aren't known for austerity, but they have introduced it at different points, show that they are also having negative impacts from those types of policies. So this is really important, obviously. So we've got a new Prime Minister coming into post today with a similar narrative about balancing the books, tax cuts and the like. And so we could be in line for another era of reduced public spending that could have similar impacts into the future. So we do think that this evidence is relevant to the situation now and not just the stalled trends that we've seen since 2010. So to synthesize across all of the evidence that we've pulled together, we think that austerity is operating at multiple levels is likely to be very important in explaining these stalled trends, that there is a contribution from the previous increase in obesity prevalence, although the contribution, the size of that contribution is likely to be relatively small and a little bit uncertain, but the other factors are unlikely to be important in explaining the trends. So that then leads to say, well, so what? What does that mean for policy? And you might be glad to know that I'm not going to go through all of the recommendations in detail because there were 42 of them, but you will be able to read them all in the report that I showed you earlier on. We didn't come up with them de novo, we didn't make them up out the top of our heads. So we based them on the previous work that we've done in this area. So we looked at the causes of excess mortality, so the higher mortality in Scotland and Glasgow. And again, that's economic in its nature. And so the recommendations from that work are still relevant, but we also updated using work by the Joseph Rowntree Foundation and others who had written much more on social security, on fuel poverty, on food poverty, on housing, on income protection policies, which is clearly relevant to trying to mitigate the impacts of austerity on health. So we've got themed recommendations across these different areas, so social security, work, taxation, public services and public service funding, the material needs of individuals, which includes things to do with the costs of living, obesity and addressing the obesogenic environment. It's worth just emphasising here that we don't conceptualise obesity as an individual phenomenon, that people choose to become obese or eat too much or not take enough physical activity. Obesity is a function of the kinds of societies that we build and how easy it is to eat healthily, how easy and affordable it is to take physical activity. So the nature of the society determines the prevalence of obesity, not individual decision making. We also have some recommendations about further research, as you would expect, and then how to link this to existing plans around social recovery from COVID-19. So I'd just like to thank my co-authors for the overall synthesis, so David Walsh, Linda Fenton and Rebecca Devine, and also all the authors of all the related papers that we've cited there. If there's anything I've said and you don't want to speak publicly in today's meeting or ask me a question, feel free to email me or tweet me on those details there. But please have a look at the report that's on the Glasgow Centre for Population Health website. And there's also a 2-minute animation that explains it all in sort of cartoon form, which is really good for sharing with networks. And thank you very much. And I'll stop there.
Thanks very much, Gerry. A lot for us to take in, but thinking about our previous events, there's lots of connections, so we will pick that up when we come into our discussion and questions and answers. So thank you so much for your time there. We are going to hear from Liz Willis now from Citizens Advice at Parkhead, and really to give us a sense of the impact of some of what Gerry's describing in the local community and the work that Liz and her team in Parkhead. So I'm going to hand over to you, Liz. Thank you very much.
Yes, thanks very much, Gerry. I can recommend the animation. I did watch that. That was really good, and I did read your report as well, and it echoed a lot of the things that we are obviously seeing as well from our side of things. Hopefully I can give you a bit of an idea about what we're seeing on the front line, and how we've seen austerity affecting our clients, and where we think we can try and improve on this, and what hopefully, you know, the people that are in power can try and do to try and relieve this. And obviously at the end of it, I will touch on the current cost of living crisis and the fuel crisis and anything we can do around that. And I know my frontline colleagues will be facing that as well. And we produced a document of suggestions and help and stuff like that. And I'll share that with Lynn, and we can share that around with people about where we can go for support for people. So just to give you an idea of where I'm coming from and where my chat is coming from, I was born in a deprived area in Hull. Fortunately, I was a vicar's daughter, so I had a good life. I had food to eat. I wasn't in poverty, but I saw poverty right away from an early age. We had people coming up to the vicarage, people without money and things like that. And the quote from The Great Gatsby that I always am reminded of is whenever you feel like criticizing someone, remember they haven't had all the advantages that you've had. And I always hope that politicians keep that in mind when they're making decisions, and that you know, you have to be aware of where people are coming from and the difficulties that they've had and where they're at. So we see that every day. And to give you an idea of what we're seeing coming into our place just now, in 2021 to 22, not surprisingly, a lot of benefits issues that we were seeing, people struggling with benefits, things were stolen, people not aware of their entitlements, and that's working people and non-working people. My concern about universal credit is it doesn't have that working title in it. We had working tax credits, and people saw that and recognised that as a support for when they're working. Universal credit doesn't really have that as much. People don't always recognise that as something they can have topping up their work. And also housing benefit and housing costs and things. People don't always realise that if they're working, they might be still entitled to housing costs or reduction in things like their council tax and stuff like that. Debt went a bit quiet during the pandemic, to be fair. It went quiet because of all the mitigations that we had. We had UK mitigations, and we had Scottish mitigations for actions against people that were struggling with debt. Evictions were stopped and things like that. So we saw a little bit of a dip in our debt. A little bit misleading, that tax stat there, 4%, that includes council tax. So that debt figure has got a bit of council tax in it, and so has the tax figure there around entitlements and reductions for council tax. And again, people don't realise their entitlements to council tax reduction. And I can't emphasise that enough, that people don't realise their entitlements. And we talked a little bit about it before we started this session. And the whole digital drive is fantastic for some people. And it's great, and people can get online and get their entitlements, but especially in Parkhead, we see so many people that are digitally excluded that either can't get online because of the costs, or they struggle to get online and the capability there, and we try and support them. So it's trying to emphasise that side of things and say, great, cost efficiencies, savings, yep, go digital, but please keep in mind people that are digitally excluded still. And we noticed that we opened up very quickly after a lockdown. Everybody locked down March, April. We were allowed to open up, I think it was August of 2020. And immediately we had people at our front door saying, oh, thank God you're here. You know, we couldn't get online, we couldn't get through to people. So it's trying to emphasise that face-to-face thing. Yes, it's costly. yes, it takes time, but you also get a lot more from people when you meet them face to face. Our advisors noticed that you get those nuances of people kind of, when you ask them about, are you struggling? And then you recognize that they are, and you can draw them out and go, right, okay, there's a debt behind that. There's a gambling addiction behind that. There's all sorts of things going on that people are not going to tell you over the phone quite often. And housing, obviously, we've got a lot of stuff around housing issues and deprivation, and the finance and charity support. Well, that's increasing at the moment. We've got people coming in for food vouchers. If I've got a limited amount of income and I can go and get a bag of food that enables me to buy the kids extra shoes or whatever, of course I'm going to go down that food voucher route. And unfortunately, I think the food banks are here to stay for a good while yet. And then employment, we do a lot of stuff around employment issues, around keeping people in jobs. During the pandemic, all the stuff around furlough, people's rights about returning to work and stuff like that we did as well. So just to give you an idea of the types of debt that we're seeing coming in, not surprisingly, council tax arrears, absolutely, that's a big chunk of what we do, and people struggling with that. And also we're trying to do that partnership with the council around people that can't pay and people that won't pay. So don't chase the can't payers with the sheriff office, and that's expensive for the council as well. And how can we really help people and support people with that, and make sure that they're able to still pay their key bills and still survive the cost of living crisis. If people are trying to heat their homes and stuff, it will be stuff like the council tax that they're going to struggle to pay and other things. And they're going to be relying on those credit cards and those store cards and things like that. That's that 22% area there. And it'll be maxing out those credit cards and trying to survive on that, as well as using other forms of credit like catalogue debts, unsecured loans. If you've got less money and you don't have the ability to get cheap, affordable credit, you have to go for this more expensive credit. So you get in that massive poverty trap again of trying to cope with everything, and then the one little crisis, the washing machine breaks or something, you don't have the savings to go out and buy a washing machine, so you pay almost double sometimes in credit buying that same washing machine that someone who's better off can potentially go out and buy as a one-off. Benefit overpayments, so they're still hanging about, and quite often they're an official error by the DWP, and how that's defined is that I've given the DWP all the information I felt I needed to give them. I filled in the form, and there was something that I didn't realise around that, and I've actually maybe declared something like a pension or something, and then the DWP, when they process that information, have missed that I've got an occupational pension or something. And because benefits are so difficult around how they're calculated and everything, it's easy to miss that. And it used to be, if that was an official error, you didn't have to pay it back. They would say, please pay it back, but you didn't have to if you're struggling and you didn't, and so you were okay. But now under universal credit, official error debts have to be paid back, regardless of whether it's the fault of the DWP. And there was something around that it forced them to learn from their mistakes because it wasn't paid back. So they had to then get their house in order and make sure they realised what they'd done wrong. And that's kind of gone. There is crucially a right to waive a recovery, so we can go in and we can argue, look, around the circumstances of that overpayment, will you waive recovery? But it's rarely used, and you'll see the stats if anyone's interested. The stats around that are so low that they don't use that discretion that they've got there. So we try and argue against that and use things like judicial review for not using their discretion. And so if you have anybody, clients, patients, whoever that are dealing with that kind of stuff, please do refer them to advice agencies, because we can try and mitigate that, so they can pay for their fuel and other things. And utility areas, sorry, that was at 9%, and I have no doubt that's going to rise. I mean, we know as people come off their deals at the moment, we haven't even seen the start of it. There's still some people are tied into good deals at the moment, but as soon as they come off those deals, then that's going to hit them massively. And also it's going to be private businesses, it's going to be the hairdressers, it's going to be small restaurants and other places that can't afford their bills, and that will be transferred into costs of employment. Just to quickly say that 29% other is coronavirus, so that was all the furlough advice and stuff like that. We had employers not understanding the furlough scheme and letting staff go, and we were able to kind of jump in there and say to the employer, this is how it works, this is what you need to do, keep them on the books just now. Then when hopefully this is all over and we've ridden that storm, you can get them back in. And really we kept people in jobs and helped keep people in jobs and give that information. And then there's stuff around, we do stuff around paying entitlements, trying to make sure that people know what they're entitled to, educating employers around that and negotiating and making sure we protect that employer-employee relationship as well, and don't risk people losing their jobs because they've spoken out and they've asked for better pay and entitlements, or actually what they are entitled to. Post-COVID, so the landscape's changed a little bit. We're still seeing a lot around pay and entitlements and terms and conditions. Grievance procedures have gone up a little bit. I don't know if that's because people are back in workplaces together and working out relationships and stuff like that, potentially, maybe. But what we do is we try and resolve those issues before they get to tribunal stage, and try and negotiate with employer and employee. And we've even had things like people on mat leave, able to tell their employer what their rights are and keep their job and then go back to their job and stuff. So we do a lot of that kind of stuff. And for me, my background is I've worked in the voluntary sector in cabs, I've worked in law centres, I've worked in councils, advice services, and come back to the cab because I feel that the citizens advice can do the whole gamut of everything. If you come in, we can pretty much do all the bits and pieces that you need to help. And if you've come in with an employment issue, you've probably got a debt issue behind there, if you're made redundant, and we can then give you advice about the benefits and stuff like that. And we do refer on, obviously, if it's complex kind of legal stuff and things like that. But on the whole, I felt that it was good because we could do more in a kind of one-stop shop thing. Welfare reform measures, obviously austerity that Gerry talked about. Absolutely, we saw a reduction in levels of benefits across the board, and it was for working and non-working people. And there was loads of little hidden sneaky cuts. For anyone that knows a little bit about the benefit system, it's ridiculously complicated, and there's all these little premiums that get added on if you're in certain circumstances and you're struggling. And they kept just like getting rid of those like almost silently, and the newspapers weren't picking up on it. So there's been a kind of general reduction in that whole across the board assistance. Changes to disability benefits, so they made them much stricter. They brought in, personal independence payment and made that a lot stricter, basically just to save money. Benefit caps, the bedroom tax that came in that was really no matter where you stayed, if you had 2 bedrooms, and even if you'd stayed there all your life and you're a member of the community, they would then give you a sudden charge for having an extra bedroom. Reduction in child addition benefits, so that happened as well. We had some good, so bring some positiveness into this. We had some good mitigations in Scotland, thankfully. We had some stuff where we mitigated the bedroom tax. People could get discretionary housing payments and stay in their homes, and then we didn't go down that whole rent arrears debacle. We're starting to see some of the Scottish benefits coming through, like the child benefits and stuff like that, adult disability, hopefully. And it's almost like we're shaming England into catching up with us, because I've just seen even this week, there's talk about trying to make less stigma around benefit claiming and around helping and supporting people who have difficulties. So that's the positive part of this. But in my book, it's an absolute false economy to reduce benefits. It doesn't work, and it doesn't work for life expectancy. It doesn't work for money saving. People shouldn't believe the hype. There's a lot of media hype around public opinion and blame culture and lazy people and all this kind of inflated information regarding costs and benefits and fraud. If you look at the fraud statistics and then look at the underpayment of benefit, the underpayment we cancel out any kind of fraud or overpayment, and a lot of it can be like mass fraud, and there's white collar fraud, the tax evasion stuff that we never hear about, counts in the Cayman Islands and all that stuff that we only hear about occasionally. So those who receive those benefits as well, they spend money locally. So our clients spend the money locally and spend it in the economy and boost the hairdressers and the businesses and the other things and stuff like that, and spend it in the local shops. So you're affecting the economy as soon as you start cutting benefits. So the thing around that is it just doesn't seem to work from what we can see. And there's a lot of misinformation around the information that gets punted out. So this was a 2014 leaflet that went out to thousands and thousands of households from the government. And what they did was they went, oh, look at all this money we're spending on welfare, we need to cut it, we need to go this austerity route, and didn't point out there was things like pensions paid in there, like doctors, nurses, police. Pensions were all included in that welfare bill, which a lot of people wouldn't consider, benefits as such. So it was quite misleading, and they didn't tell people that. And a big chunk of the benefit and welfare spending is state pensions. People have earned those state pensions, they've paid their tax, they've paid their national insurance, they've earned it. But they don't tell you that. They just go, oh, look at this 217 billion we're spending on benefits, it's outrageous, we need to cut them. But actually a big chunk of that is state pension. Disability benefits, and we know the rigorous medicals people have to go through to satisfy those, and are genuinely sick. Child and working tax credit, so it's there in the bill as well. Housing benefits again, which is often with people that are working as well. child benefits, and the so-called scroungers on employment benefits are a tiny amount of that pie. And a lot of those people, even that, some of that includes people that have been working, they're temporarily out of work and then they get work again. So it's trying to get that across to the general public as well, you know, about don't believe this hype around spending on benefits, and actually maybe we do need to spend a bit more on benefits and come out of this you know, economy slump, because people do spend it in the local community. And then there's just another one, just again, another example of how it's all made up. And we're a society, so we should be contributing and we should be trying to, you know, share the costs and stuff like that. But let's not go down this blame culture. There's other things that get paid for. There's a big education bill, you know, and all these other things that we pay for within that. So let's not go down this route. Ripple effects on public bodies when benefits are reduced. So what we see is clients in with stress from lack of finances. Debt directly affects their mental health. That all pushes on to health services, you know, and costs money for the health service. You know, we see people quite often have been in really good jobs and they've been made redundant, and they cannot believe the low level of benefits because they've read all that stuff in newspapers and they've gone, but I've worked all my life, is that all I'm going to get? And you're like, well, yeah, unfortunately, yes. And they've believed that hype. They've thought, oh, I'll be great, you know, it'll be fine. The stress of parents and poverty as well translates to children. If the parents are stressed and struggling and trying to manage and cope and get the next food and pay for the uniforms and different things, then that can ultimately contribute to violence in the home, stress, breakdown in relationships, and a resultant childhood trauma as well. So let's try and tackle that child poverty and tackle that stress in the home to try and make a healthier life for everyone. And lack of heating, we're going to see that. I mean, that it's going to come in the winter, especially now. Lack of heating. There was a really good study, and I'll need to look it out again. It was a GP and other things in a study around lack of heating leading to hospital admissions, and it was around falls and stuff. And it was something to do with, you know, not having that sensation in your hands that you can kind of feel your way around the house and stuff. And they'd realised that was leading to falls and stuff. And then the costs around hospital admissions and falls and stuff is phenomenal. And yet, if we can get people the right benefits and stuff, and get things like, you know, the grab handles, all that kind of stuff, and there's a limited budget for health and local social work. So if we can help clients, we'll say to them, right, you can use this benefit to buy extra things that might help you, like a small tipping kettle that, you know, you're not going to scald yourself now, all these kind of things, and we'll try and help that client to be independent. I see a lot of older clients that are like, oh, I don't want to make a claim, I shouldn't be claiming, you know, I've got other money. And I'm like, well, you know, ultimately it'll save the government money, because if we can keep you independent in your home, you won't be costing the government money. You can use that money to buy these things, and then you see them kind of go, oh, okay, right, no, I get that now. And what they spend their money on could be something like going out socially, and then their mental health's better, you know, and doing things like that as well. So there's a big knock-on effect here around all of this. And as soon as we start making those benefit cuts and going down that austerity route, there's a ripple effect for public services across the board. Rent arrears lead to costly eviction proceedings. It's all costs on the public purse. So for our book, it is absolutely, you know, it really is a false economy. What can we try and do about it? Well, we can try and increase financial support. We can try and automate benefits and entitlements as much as possible. People don't know what they're entitled to. It's incredibly complex. It's ridiculously complex. Advertise benefits with information on amounts, I think, to let people know, if you're a pensioner, this is a minimum you should be on. If you also get an attendance allowance, this is what you're entitled to. Here's the amount, 180, 90 quid, whatever it is. Oh, wait a minute, I only get 180, right? That means me. Make it really easy. Maybe we should go back to old-fashioned leafleting. You know, we punt everything online. We go social media, Facebook. We're obsessed. We do it too. 1,000 leaflets actually to distribute is really cheap, I found out. So maybe we need to do that a bit more and make people sure they're not losing out. Maximise benefits now before we migrate to universal credit. There's a whole load of additional benefits that once you claim universal credit, you can't go back. So there's an additions like severe disability premium, that if you have it and you migrate to universal credit, you get a transitional protection and you keep it. If you didn't know about it and you claim universal credit and then you found out, tough, too late. So we need to get that information out as well, and get people and get the income before that happens. And provide better childcare provision and other supports for those working. It's incredibly difficult to juggle everything and juggle your childcare and juggle the school run and make employers more flexible around that. And let's see what we can do about that. it usually is the lower paid and the more impoverished that struggle to get jobs where they can work from home or where they can be more flexible. And it's how we do that then and provide childcare provision for people who do want to work, but support people that maybe aren't able to as well, and how we do that. So it's a little bit of a lightning tour of what we see and what we see as could be helping it. But I also want to say that there's other things around. We said about digital choice by choice, not by default. Recognise that people's lives and their problems can be multiple and complex. So advice does take time. So we are very much about not being a quick call centre and going, right, that's that answer to that one, bye, see ya. Everybody we get, we're like, right, well, actually, see while you're on the phone, can we just do a benefit check for you? Because you never know what you might be entitled to, you know, and we try and really try and push that. Or if they're working, we're like, actually, do you know, you could get some support because they're struggling. Some people get pushed into work and they find it so difficult and chaotic and don't realise what they're entitled to, that they just crash out of it again, because they're like, I couldn't cope, I was trying to pay my rent, I was trying to pay my travel to work, I was trying to get the kids to school. And if we can try and support people that do want to go into work properly and give them that more complex advice to support them, then I think that will work better. And fund long-term training and posts for the advice sector. Don't lose that expertise and investment. We've got really good staff here that know their stuff, and it isn't easy, and it takes about a year to train people up. So let's invest in global advice services across the board and make sure people get what they're entitled to. Current crisis, well, let's just hope that the government support, national, local is going to come in, but actually somebody needs to step in, and we need to lobby for a better solution here, because if we don't stop those bills coming in, people will cut themselves off. We've got a raft of prepayment meters kicking about now, especially among the people that are impoverished, and they will cut themselves off. It used to be back in the day, there was an outcry, oh, you know, the lucky man's coming to cut people off, that's outrageous. We won't see it, it'll be invisible. People will not be able to put their prepayment card in their meter, and they will just cut themselves off. And then we'll see that affecting health and other things, and that will push on to health services and social work. There's things we can look at, and we can certainly try and help people. We've got charities and benevolent funds we can try and access. There's some bizarre benevolent funds out there. People were like an engineer, if they worked in the bakery trade, if they worked in the clothing trade. There are charities out there that we can try and tap into to support people. So if any of my health colleagues have got patients and clients that are struggling, then please do refer them. We've got fuel vouchers we can tap into, and getting people onto social tariffs and stuff. And I've done a document that I'll share with Lynn at the end, that we can punt around everybody if people need access to that. And we're going to do some links on it and stuff, and just really try and get through this another SHIT storm that we're about to hit again. So let's do that as well. So I can absolutely echo what Gerry said. We can see how austerity has affected life expectancy in people, and the stresses we see every day coming to our door, and people presenting themselves at our door. We have doubled in people trying to get our help, and we are struggling to cope. And it's that big thing that advice agencies always have, and it's a quality quantity debate. We want to help everybody, and then we want to help everybody as much as we can and do a quality job when they do see us. So we are struggling, and we're having to turn people away and give them other options like phone lines and stuff if they're not an emergency. So we need to do something with that. And I think some advice agencies are a bit scared to let the funders know that how much we are struggling, but they do need to know. And because people that are referring to us are hoping that we're going to help people, but the appointment times and the emergency times are really shifting. But once I end it on a positive note, we are here, the advice services are here, we're here for health and people and social work, and to try and do that, and we will get that sheet out to kind of help people. And hopefully our discussion after the break will be around people's ideas around what can we do to mitigate all this, you know, how can we help people and what can we do to try and resolve it. I've been in advice for 30 years, and we keep thinking, oh, we're nearly over it, we're nearly over welfare reform, we've nearly improved things, there's some stuff coming in that's helping child poverty, and then it just happens again. So we know we're probably all going to be here another 10-20 years still fighting the good fight, so we need to invest in that and in advice services as well. So that's my piece, Sheena, and I hope I haven't rabbited on too much. And I'll just stop there, and then we can go into the break of the discussion.
Thank you so much, Liz. There's such a lot to take in from yourself and Gerry's inputs. We've got some questions starting to come in, and we've got a little bit of time for discussion and more questions, so please do have a think if there's things you want to say or ask about. You mentioned a break there, Liz. Shall we take a very quick break and then come back. I'm thinking we just take a comfort break, but we'll come back and discuss, and if it takes you a bit longer to have your break, that's fine. But I know people have been sitting for a while, and we're talking about health and well-being. Even if it's just a quick break, come back and we'll keep the conversation going, but feel that you can take a break if you need, because I think we've got lots to talk about and lots of connections, I think. And thank you both for having some solutions and recommendations, because I think that is really important right now, that we have some examples of things that are working or priority areas for us to think about in all of our different roles. So if we just take just a couple of minutes and then we'll come back for discussion, but if you need longer, please do take it. Just give people time to join us in their own time, but I want to make best use of our time. So thanks again for that input. It feels like there's lots for us to consider, and I see people saying, you know, they'll have a think and touch base with colleagues, someone that needs to go. So we've got a question from Faye. Oh, thanks, Faye. I can see you're back. And Jerry has responded in the chat. Thanks for that, Jerry. But with a particular focus on gambling harms. So I know, Liz, you've got a specific project around gambling harms, but Faye, did you want to come in to ask your question? I can't hear you, Faye. Can others hear? No. Oh, we'll let you get your audio sorted.
It's always that hidden audio in the settings, I think. Sometimes.
Yeah. So Liz, Faye has asked about gambling harms as an issue for people that you're supporting.
Absolutely. I mean, you know, Jerry talked about it a bit as well. I think that when times are tough, people often go for routes out of reality and stuff like that, or it's that desperation of maybe, you know, if I win the bingo, I win the lottery, you know, I'll change this situation for myself. And we don't have a specific gambling project, but we can refer to gambling support. And we had the gambling support folk actually recently at a team meeting just to raise awareness with our staff. Our money advisors often come across it. So it's often quite subtle. They'll build up a relationship with the client. They'll be looking at, you know, their expenditure and stuff. And then during the course of doing the kind of income and expenditure, they'll be thinking, there's money available that, how can that be available if they're still struggling? And then once that trust, the client will then often say, well, actually, yeah, I do spend some money, or it'll appear in a bank statement or something like that. And then that conversation will start up around, you know, the gambling part of it, or it could be a relative or someone in the household who's also managing the finances who's got the gambling addiction. And then it's just how we try and support that client and try and put them in touch with gambling support services around dealing with that issue. But it can be something that is really hidden under the radar, and why people are struggling. And it'd be good to hear from anyone else that's dealt with that or referred people, because we talked about how our staff deal with that, and obviously we have budgeting conversations, we have financial capability conversations with clients around, you know, ideas for reducing their income and expenditure and things like that. But also often there's nowhere to go on people's income and expenditure. You know, it isn't, you can't just give them budgeting advice. It's literally they don't have the money.
Yeah, thanks, Liz. And I think you are connected to our gambling harms work, but we've now got our development post and CVS looking at gambling harms and the community. So it'd be good to connect with about that. And certainly we're seeing, I guess, gambling being at the point where suicide prevention was a number of years ago, where becoming comfortable with asking the question, or certainly the last event we had people talking about the need to spend time with people and build up a relationship, because somebody's maybe not going to disclose that in the first conversation they have. But it's that building trust and really understanding a person's circumstance. So yeah, we can certainly connect on that issue as we out with the session. Jerry, please come in.
Just to kind of add to that, so I agree with all the points being made about gambling, and it's a scourge. I think we also just need to remember that we should never, and I don't think anybody's done this today, but we shouldn't individualize the issue. So we've got an industry that is one of the most exploitative industries that is out there, and it's akin to the tobacco industry. So, you know, there's no good that comes of gambling. It's the setup that they've created with these you know, addictive machines within bookmakers, where, you know, people are just feeding the coins into the machine, or even using their cards for instant rewards. I mean, these are all designed with, you know, people's psychology in mind to just exploit those that can't afford it, and to generate profits from people's misery. And so we really need regulation, we really need laws to try and limit this harm in society. And I think it does need to, yeah, in the public health world, we refer to these as the commercial determinants of health. He's absolutely right. And, you know, we need to treat it as such, in the same way that we've treated the tobacco industry and the alcohol industry in the past. And we see that in other areas of life. So I think there's a real need for government action, and it's become so insidious. So we've got a whole football industry now, which is, you know, such a big thing culturally in Scotland, which is now dependent on gambling money. You know, we can't have this kind of unhealthy relationship between big areas of our economy and these kind of exploitative industries.
Gina, I would echo that from Gerry as well, and also I think where he's saying about, yeah, the government needs to step in. There's stuff around online gambling, and also apps on phones now that draw people into this thing. There's very little control over that kind of side of things as well, and younger people, we're seeing a lot more younger people getting caught up with gambling and through that kind of pathway as well.
Yeah. Thank you. Absolutely. And it's seeing, it can often be hidden. Anne-Marie, you have your hand up. Welcome.
Thanks, Sheena. I suppose it was just a wee observation, Liz, when you were speaking about some of the things you've seen as recommendation. You spoke about the possibility of reintroducing good old-fashioned leaflets like we used to do in bygone years. And I know a number of years ago there was a study done around young parents and how the, you know, information-seeking behaviour for young parents, and what came out was actually seeing the whites of somebody's eyes. We all assume that they go directly to Google or apps or whatever for information, but in actual fact they valued information coming from a human being and not an app or one of these sites. And I suppose for me the other thing would be the work that I'm doing just now within Glasgow Life is around the level of literacy in the city and the literacy hotspots we've got. And I think absolutely it's all well to have nice leaflets for people to read, but I think sometimes we don't check the ability that people have or the skills that they may have to be able to not only read the leaflet but understand how it can help them. And again, going back to a study that was done a number of years ago, I think over 20 years ago now, around people's behaviours in improving their own health and consultations that were taking place around ischemic heart disease, diabetes, you know, some of the diseases, and people presenting to a consultant, being given information and a prescription and sent off to look at the kind of self-help that they can do and use the information that was given to them. And on representing back to the consultant, there was very little change, and it was because of the level of literacy people had to be able to understand the information they were given, and indeed to be able to take their medication in a correct way as was prescribed, because it all came in written format and nobody actually took the time to give that explanation. So I would agree with you totally that we need to invest in workforces that have the expertise and skills to be able to support our citizens and help improve things for people. But equally, if we're identifying that, recognising that there is places that we can support people into to help improve. You know, we have ESOL learning and literacy and numeracy learning where we can actually handhold and support people to access these things. And I think if we just maybe worked a wee bit better across the city, we could help these things to take place. So it was really just kind of more of the observation, and I do agree with you. The leaflets, giving somebody something to take away and have in their hand is probably more value than directing them to a website or whatever.
Yeah, I completely agree, and we bang on about the literacy thing all the times, and the classic thing is people say they haven't brought their glasses and stuff like that, and we know there's a literacy issue, and then how we refer them or start to have that conversation with them about would they like to engage with kind of literacy help and stuff. I guess the leaflets I meant more around just awareness raising rather than giving them guides or information, because I totally agree. And we found that it's the hands-on help that really works, and my worry is there's a lot of national helplines for debt and stuff, and they just pop out these guides to people and go away and do it yourself, and they never do. They end up in crisis and come to our door. And I would agree with you, it's how we support those people, and I guess for us as well, it's how we try and get out in the community as much as possible and engage with local community groups and do that thing and have those conversations with people. So I would completely agree with you, and we definitely need to do that. There's resource issues with that for everybody, and having people, and we have volunteers, which is fantastic, and we can go down that route as well. But yeah, absolutely, we've got a helping hand buddy in our money advice service at the moment that we got through project funding, and she literally does handhold people through that money advice process, and it's working really well. She's not a money advisor, she's specifically there for the client that's struggling, to help them through that process, because the money advice process can be quite involved around dealing with creditors, trying to do an income and expenditure and all that side of things. So yeah, absolutely.
Thank you. And it's the point about the whole person, isn't it? What you think you're doing to support someone, but having the time maybe to follow up. Or I'm thinking about our connections with our maximising independence work and ideas around supporting the community and maybe volunteering, having people that can follow up. So it'd be good to hear more, Liz, out with here about that helping hand buddy. I've taken a note of that. That would be good to hear more about. And thanks Anne-Marie. Nice to have you here. And it is that coming together, isn't it, and supporting each other with the conversations, or looking at where we can build capacity to support people best in the community. And we've got some questions coming in. A comment about the programme for government this afternoon, announcements on Scottish Child Payment and a rent freeze. Gerry, Liz, any thoughts on this, or what you'd like to see in terms of responding to the current crisis? Lynn, you might want to add to that question.
I think that pretty much, yeah, I guess my question was, there's stuff popping up on the programme for government this afternoon, which we're seeing some leaks around that about what might be announced. I guess my concern is a lot of that stuff isn't nuanced enough around the kind of risks and groups that we know who are more at risk in this current crisis. So I guess, Liz and Gerry, any thoughts around what you think you'd like to see, given what we've discussed this afternoon or this morning around
coming down. Stop letting the fuel companies charge this ridiculous amount of money. I mean, people literally need hard cash. It's got to that point where if they can't put their heating on, it will be people in crisis, stressed, suicidal, leaning on health services, and going into hospital or prison for a heat. I mean, I joke about that, but actually we've had clients that used to say that. And I remember back in Hull, when I was little, people coming to the vicarage and going, "Oh, Vicar, I'm just going to go and smash a window and get back in prison again because I get a heat and I get some food." And that's the point that we could get to if we don't do something seriously about it.
Yeah, and we've had
that's how I feel about it at the moment.
Yeah, but we've had people describe that, Liz, where what seems like the worst outcome can actually create stability and predictability for people. Absolutely. So we want to find some solutions for that. I'm thinking about the connection, the austerity, and we've heard really well about the ripple effects of that for people and their health and well-being. And I am really concerned about that mental health impact of people worrying about it and the people's response to that. But I'm also thinking, Gerry, in the themes that came out, obesity seemed to come up as something not in itself, but almost the impact of lifestyle and other factors. And we know that when, the impact on having enough funds can affect that. So I'm thinking about the themes that we're looking at within our other bits of work, is obesity an area to look at as well in terms of preventative work and support for people in terms of their opportunities? Because it might feel like a luxury right now for people to think about exercise or fresh food, or so do you think that's an area connected to austerity that we should be thinking about?
So can I come on to that in a second, Sheena? I'm quite keen to address the last question, if that's all right. If
Of course.
I've ever got the opportunity to influence the programme for government, then I might take it. So I would categorise it in 3 ways. So sort of incomes, costs, and then longer term investments. So as Liz has kind of highlighted, we need money in people's pockets, and there's a range of different ways of doing that. The Scottish Government, to their credit, are working up proposals, and I'm involved in this to a degree, around a minimum income guarantee, so trying to create a floor below which people won't fall. So sort of plugging the holes in the social security system and the wage system that we've got at the moment. There's a long way to go on that, but that as an approach seems entirely reasonable. It also needs an approach in relation to wages, because there's a lot of in-work poverty, as people know. In terms of costs, obviously inflation is affecting lots of different things, but there are areas which the Scottish Government could reduce costs. So for example, around transport, widening free public transport, around housing and registered social landlords and council housing, rent freezes, rent reductions, those kinds of things, making more council services free, including leisure services and like, reducing the kind of pressure on school-related costs, and then energy. And I agree with what Liz has said as well about the profiteering that we're seeing around energy companies. In the long run, though, we need to decarbonise. We need to get away from our fossil fuel dependence. And so, oil and gas prices in the long run are only going to go up. So we need to invest somehow in housing retrofit so that actually we're not dependent on gas boilers. We've got district heating systems. We've got ground source heating systems. We've got air source heating systems that electrify that. We need to expand the public transport system so that we're not as dependent on cars. We need to redesign our food system, which does start to talk about, Sheena, what you're touching upon. So the biggest driver of obesity is not physical activity, but it's food and the quality of that food system. But we need to decarbonise that as well. So it's not going to be sustainable for us to have such a dependence on meat and dairy in that system. So how do we localise that? How do we make it healthier? How do we make it, eradicate food poverty? Do we, start to think about community canteens and cheap kind of all available cafes that are subsidised, that allow people to eat and heat and socialise in a sort of a different way of imagining how we run the food system at the moment. And essentially, how do we in the longer run take profit out of the foundational economy? Now, that's a big long wish list, and I think it's also right, and I don't want to make a political point here, but the Scottish Government do have a fixed budget, so they don't have control over monetary policy, and so a lot of this does depend, frankly, a lot on the UK Government approach to this. And austerity comes from the UK Government and then sort of trickles down, if you like, to the devolved administrations. So there is a real problem for the Scottish Government about how they balance that. They can raise taxes, or indeed if the Westminster Government reduces income taxes, we could maintain them in Scotland, which would generate additional revenue relative to the rest of the UK, but might not generate additional revenue in real terms. So there are challenges around that, but there are also things that can be done around, for example, local government taxation, which at the moment is very regressive, and that could be redesigned so that it pulls more money in from the richer groups and allows subsidisation of services and reduced tax burden. So there's a quick list in the PFG.
Thank you. So we just need them to listen to that and do it. Thanks very much. Some things for us to think about. Lynn, do you want to come in and your point about disabled people and carers and the care charges?
Yeah, what strikes me, I maybe partly responding to Gerry here around what the limits of the Scottish Government can do, and I'm absolutely right, the monetary policy element will always be there as long as we have the current setup. But it strikes me that there are times when we're dragging the government kicking and screaming into doing something, like removing care charges is a perfect example. So we have families that, through the events that we've had, also in my role as an unpaid carer, who are paying something like £90 a week off benefits. It's like you end up with very little to live off. So it's the one thing the Scottish Government can do that would have a massive impact on people's lives very, very quickly for a relatively limited cost. But they reckon around 50 to 70 million is what what we think that might cost. I've seen ministerial responses which basically say we expect increased demand, and we know that didn't really happen with previous changes. But I guess what I think will happen this afternoon is it won't be nuanced enough to respond to those groups who really are going to be at the forefront of the pandemic, the cost of living crisis, and I don't know how we change that lack of understanding about how small tweaks can make a big difference to people's lives. So I'm kind of frustrated to some extent that we'll see some good stuff this afternoon within limits of what it's got, but there's just that. It's the groups that you mentioned, Gerry, that come up again in other public health research that are at the forefront of all these crises, who yet again are at the forefront of this one. And we just don't see enough nuanced policy to respond to that in that very round. But I think you get my gist, hopefully.
Yeah, thanks, Lynn. It's the plea that we hear, isn't it, about what you can do now, not the longer term, but what can we do right now that could make a difference to people. I'm just keeping an eye on the chat. If you do have any comments or questions, please, we've got another few minutes. There was something I was thinking about. It came up in our first session of the Health and Social Care Network, and it was about the role of the media, and it's been mentioned a couple of times today about the media and either not picking up on an issue or misrepresenting situations for people. And I'm really thinking, I guess, for the next discussion about our role as a network, is there something about the media? Our session we had Donald McCaskill for Scottish Care, and there was a discussion about media in terms of how we elevate the role of health and social care and the positive input of a career in social care, but also the reality of people's lives. And I'm hearing a bit of that today as well, about how we share the relevant information, whether it's about what people's entitlement is or where they can get support, or translating information from complex medical or financial information into layman's terms. So is that something you see as, what could we be thinking about in terms of media, thinking about our network? I think Liz and Gerry, you've both mentioned media at some point. Liz, you're smiling, so it's a key issue for you, I think.
Well, yeah, and when I touched on it, and I talk to social work students about the influences of media and all the fraud stuff, and it's the stuff people used to go on about, oh, people on benefits, look at them with their big TVs, and it turned out, I think it was Bright House or somewhere, they only sold big TVs. So if you had to get a TV on credit, that was the only TV you could get. You couldn't get a smaller TV because they only offered you that one, and offered it a ridiculous amount of money. I remember the days when there was the slot TVs as well. We had TVs in the houses where you had to put £1 in the TV to make it work and stuff. So there's a lot of stuff in the Channel 5 programmes and whatever programmes don't missell a lot of that thing, and that influences is how government policies are developed, how the public, because the government has to follow the public view and the public opinion sometimes for vote. I guess it's how we talk to media and how we involve media, because they want to sell newspapers, they want to get people watching their programmes. How do you make reality interesting without it being, overinflated nonsense? I don't know. I guess it's how we deal with the media, isn't it? It's how we, because we get approached sometimes by the media. Oh, have you got a client that's struggling? Would they come and talk to us? And inevitably, people don't want to be on TV to be shown that they're in poverty and that they're struggling, and they're worried about being judged or someone watching them or whatever, or the neighbours commenting on it. So it's hard to show people the reality of what living in poverty can actually mean. But yeah, I think it's how we do that in a respectful way as well, so that if we are involving our clients in trying to communicate that, how do we do it in a respectful way that people will still engage with, but it's not sensational. Yeah,
thanks Liz. And how we influence that, maybe that was a bit of the push.
And it's hard not to be like, I think a lot of people that work in services that are constantly dealing with issues like this, it's hard for people not to get fatigue with it, it's that people call it compassion fatigue, and it's hard to keep that non-judgmental approach and remember that that where people are coming from, and that they haven't had the same life that you've had, and you might have been more fortunate and stuff. I guess it's that how you keep that energy up as well.
Yeah, thank you. Gerry, please do come in.
Just to add to that, so it's a big problem, and it's not a surprise because we know that the ownership of the media outlets is very skewed in this country. So we have a very small number of very rich owners. We don't have a very plural and diverse media ownership, and they've got a particular agenda that they push, which is about demonising and individualising the problems of poverty and inequality, and sort of fostering that blame culture. So we're up against it in that regard. So what can we do in the face of that? So I guess we need to build alternatives. So there are media outlets that will give a more balanced view, and so we should support them and try and foster them and support them wherever possible. More practically, some of you will be aware of the Frameworks Institute. So like the Poverty Alliance commissioned some work from them previously. Various public health bodies have used them previously, and that helps when you are speaking to the media how to use metaphors and synonyms that allow a much more positive public response from and through the media. So you will have seen the Poverty Alliance, for example, using metaphors like trapped and locked in poverty, and these metaphors get a much better response from the public interpretation than alternatives. And so I would encourage you to look on the Frameworks Institute website. They've got lots of advice and support on there about how to better engage with the media and what kinds of frames to use, what kinds of ways to communicate that has a much better response. But I also think if we can, we should try and engage with that sort of media environment, because influence in the narrative is really, really important. Everybody hates doing it. I don't know anybody that loves doing media work, but it is so important. So yeah, well done to those that keep doing it.
Thanks very much, Gerry. I'm certainly not aware of that, so we can have a look and maybe share. Oh, like magic, Lynn does it. Maybe we could share the information. It's in the chat already.
I think as well, Sheena, sorry, just to put in as well, I think for some of the older ones of us as well, you can't underestimate the power of these things like TikTok and stuff. There's a lot of opinions riding around on TikTok and other things on that, and you're like, God, do we have to try and engage with that in some way? And just hearing the other day about somebody and they were getting influenced by TikTok around Ukrainian refugees, and I was like, oh my God, are we back here again? Negative information about it, and I was like, right, that's quite scary that kind of opinion is circulating around again. And do we have to be up to date and start to engage with these things a bit more?
Yeah, and we need to be aware, even if it's not our preferred format or medium, don't we? Yeah, Gerry's saying social media, the prime source of news for young people. We've just got a couple of minutes left. We're going to think about the network, but I see someone has just put their hand up. Where are you? And it's gone down again. Oh, Rachel Curry, would you like to come in?
Hi there, sorry I put my hand up and down. It was just when we were talking about social media and young people, obviously that is a massive way that most people, like most young people, get their information. I think it's really important how information is shared on social media. It's really small sound bites. I think what I've noticed, especially from a lot of kind of institutes and professionals, is that online they share links to studies, they share quite complicated information, where it's a lot easier to share, a kind of false opinion about, for example, people on benefits having a large TV and not having to back that up. Someone just needs to scroll past it, look at it and go, okay, and move on. Whereas I don't think sometimes we share information quite as snappily as we could do within kind of like social care. And I think that would be something to look at, is if we are going to utilise social media, to utilise it as it's designed to be, kind of short, sharp bits of information, which possibly does mean simplifying things, but that is where the kind of negative information is coming from.
Great, thanks, Rachel. Thanks very much, everyone. We've just got a few minutes left. We did want to just reflect on the Health and Social Care Network. It does feel like there's a few strong themes coming up already in just 2 sessions. So I'm thinking, Lynn, maybe we put a date out for people to come together who are interested in shaping the network and what our priorities might be. I think if we have any more sessions, we're at risk of having too many priorities before we even get started.
For those who don't know about the network, this event was built as part of a voluntary sector health and social care network that GCVS is setting up, because obviously there's a whole lot of issues around health and care policy that affect the voluntary sector in Glasgow and beyond. But a lot of these sessions we're opening up because obviously what Gerry and Liz are saying today has much wider impact. But there will be times when, particularly around things like the National Care Service, for example, where the implications of that for the voluntary sector in different ways we are still looking at and working out. So part of the network will be purely focused on the voluntary sector. Other events like this will be open to anybody who's got an interest in health and care policy, because it's been an absolutely fabulous session today. So we'll share the news of the network with people who came today when we do the recording, and the stuff that Liz has mentioned, and share obviously the report again that Gerry had mentioned. But if you are from the voluntary sector and you're keen to get involved, then get in touch with myself. And also if you've got ideas of future events in terms of discussions that we could have, are issues that the sector wants to focus on. One of the things I've looked at is media training, and I've spoken to STV about potentially doing one of their expert voices sessions with us. They do brilliant training on how you get your message across. So there's things like that we can do, but get in touch. This was part of the network, but obviously just a bigger event, and we can share how that would work with you. But it's essentially a place for us to get together to look at health and care, which is a massive policy area, as we know, and is something that the third sector is deeply involved in many different ways. So we appreciate your time and everyone getting involved in that so far. But we'll stay in touch and share some stuff, maybe hold an event just maybe before Christmas, for people to get together. Yeah. And just maybe reflect on the year and look at what we should be looking at, the kind of events we should be doing. We're hoping to do some face-to-face events in future, look at hybrid approaches. So for many people like myself who are supporting people who are shielding still, COVID is still very real. So there are families who we know, people who are happy to still stay online because it gives more access. So yeah, any thoughts you have, let us know, give us a shout, and happy to chat to people individually about it as well. Thank you.
Yeah, thanks very much, Lynn. So we're at our time. A huge thank you to Gerry and Liz for such a wealth of knowledge and expertise, and for your time. We know how precious everyone's time is at the moment, so really thank you so much. And I think lots of things to follow up on for us to consider within all of our work, and really how we support each other through a really challenging time to come as well. So thanks very much, and look forward to speaking to you soon.